Hi, my name is Professor Megan Salazar, and this is going to be part 2 of our emergency preparedness lecture. This part of the presentation we're going to be talking about START triage. The goal of START adult triage is to save as many lives as possible with the resources available. Patient assessments should ideally be done in 30 seconds, definitely no more than 60 seconds per patient. In this triage process, you'll be using a color-coded system. Other medical professionals will be following behind your triage to treat the patients based on your tagging assessments. There is also a pediatric triage. It's called Jumpstart triage, and that would be used for ages 8 and under. You don't need to know this for our purposes. START triage is actually a flow sheet. You can find the flow sheet in your textbook on page 2788. It's figure 46.4. You can see the entire triage paper. I kind of wanted to break it down a little bit into separate things. So definitely look at the flow sheet itself in the textbook, but we're just going to be going over the parts of the flow sheet and then having some practice questions at the end. So the first part of the flow sheet asks you if the patient is able to walk. Anyone able to walk is going to be asked to move to a secondary triage where they can be assessed for more serious injuries. These patients are always labeled with green tags and are considered minor. Now that the patients that can walk have moved to a different location, you will be assessing all the patients left. The first assessment that you're going to do is you're going to assess for spontaneous breathing. You just need to ask yourself, are they breathing spontaneously? If the answer is yes, you're just going to move on to the next assessment. If the answer is no, you're going to take a second and you're going to reposition their airway. You can do this with a jaw thrust or some neck positioning. Then you're going to assess if your positioning changed the situation. So did the positioning in the airway result in spontaneous breathing? If the answer is yes, they did start spontaneous breathing, they are tagged with a red tag and considered immediate. If the answer is no, that they didn't start breathing after repositioning, they are tagged with a black tag and considered expectant. Now that you've assessed that your patient is spontaneously breathing, the next assessment you move on to is their respiratory rate. Any respirations greater than 30 are tagged immediate with the red tag. If the respirations are under 30, you'll continue down the flow sheet and just continue assessing the patient. So now at this point in our assessment, we have a patient that is not able to walk. That's why we're assessing him. They are spontaneously breathing and the respiratory rate is under 30 breaths per minute. The next assessment you'll do in all of those cases is assess perfusion. If the radial pulse is absent or a cap refill is greater than 2 seconds, then you will tag them red for immediate. If they do have a radial pulse present and or the cap refill is less than 2 seconds, then you move down the flow sheet to your next assessment. So now we have a patient in our assessment that isn't able to walk to the green location. They are spontaneously breathing. Their respiratory rate is under 30 breaths per minute, and they have either a radial pulse or a cap refill that's less than 2 seconds. The next assessment that we're going to do is mental status. The mental status exam just includes whether or not they obey commands. If they do not obey commands, they're then going to be tagged red, immediate. If they do obey commands, they're going to be tagged delayed, yellow. And this is the completion of the flow sheet, and from here you just move on to the next patient, and the medical providers or nurses behind you will be able to treat patients based on your tagging assessments. So from here on out in this presentation, we're just going to go through some practice questions to help you understand the START triage process. This is question number 1. The question reads, you are working as a triage nurse during a disaster situation. Based on the triage color-coded tags placed on each of the wounded, which tag color represents the wounded who have the highest priority of being treated first? So your choices are green, yellow, red, and black. The answer here is going to be red. The red tag indicates that the patient must be seen first because they have a life-threatening injury, but could survive if treated quickly. The patient is still alive, but there is a severe alteration in their breathing, circulation, or mental status that requires immediate medical attention. Question number 2. A catastrophic disaster has occurred 5 miles from the hospital you are working in. The hospital's disaster plan is activated, and the wounded are brought to the hospital. You're helping triage the survivors. One of the wounded is able to walk around and has minor lacerations in the arms, hands, chest, and legs. You would place what color tag on this survivor? A, red, B, yellow, C, green, or D, black? The answer here is going to be C. Green tags are for patients who have minor injuries. If the patient can walk around, and then they are always tagged as green. Sometimes they are referred to as the walking wounded. Question number 3. Which statement below is incorrect about the yellow triage tag color in regards to a disaster situation? A survivor with this tag color is seen after patients with the green tag color. B, a survivor with this tag color can have treatments delayed for an hour or less. C, a survivor with this tag color has serious injuries that could eventually lead to the compromise of breathing, circulation, or mental status, especially if treatment is delayed more than an hour or so. Or D, a survivor with this tag color has second priority for treatment of injuries. So just remember the word in here is incorrect. Which statement below is incorrect about the yellow triage color? And the answer here is going to be A. This statement is incorrect. It should say a survivor with this tag color is seen after patients with the red color, not the green tag color. Now we're on to question number 4. For all the remainder of the questions, we're going to use the START method for adults to help triage the wounded that have been involved in a disaster situation. So each question is going to give you details on what you've assessed and what you need to use, how to use those details to help you assign a color tag to those individuals. So this first question is, the wounded victim is unable to walk, has a respiratory rate of 40, cap refill is 6 seconds, and he cannot follow simple commands. Which color is this victim tagged as? So the answers are A, green, B, red, C, yellow, or D, black. So if we go down the flow sheet, the victim is not able to walk, so he does go through our assessment. I'm assuming because he has a respiratory rate of 40, he is spontaneously breathing, but his rate is over 30, so he would immediately, at that point, be assigned red. The answer is B. While triaging the wounded from a disaster, you note that one of the wounded is not breathing, radial pulse is absent, cap refill is greater than 2 seconds, and he does not respond to your commands. What color tag is assigned? And this should be a fairly easy one, but the answers are A, green, B, red, C, yellow, and D, black. Your answer for this should be D, black. The black tag is placed on the wounded that are dying or have expired. The injuries are so severe that death is imminent. There's a severe alteration or absence of breathing, circulation, and neurostatus. Question number 6. The wounded victim is unable to walk, so you're going to be assessing him. Has a respiratory rate of 12, which means you continue your assessment. Cap refill is 8 seconds, and he is unresponsive. The wounded victim is assigned what tag color? A, green, B, red, C, yellow, or D, black? Your answer is going to be B, red. I already kind of went through some of the steps when I was reading the question. He has respiratory rate of 12, so we continue our assessment. But then when we get to the cap refill on the perfusion part of the assessment, his cap refill is greater than 2 seconds. So at that point, we don't even need to know if he's responsive or unresponsive. We just go to red, which is immediate. Question number 7. The wounded victim is unable to walk. He has a respiratory rate of 19, cap refill of 1 second, is able to obey your commands. Which color would this victim be assigned to? A, green, B, red, C, yellow, or D, black? The answer of this should be C, yellow. Because the victim is unable to walk, we will do our assessment, but he has a respiratory rate less than 30, so we move on to the next assessment. He has a cap refill of less than 2 seconds. We move on to the next assessment. He does obey our commands, and so that makes him a yellow. That's going to be a delayed tag. Question number 8. The wounded victim is unable to walk. Respiratory rate is absent, but when you reposition the airway, breathing is noted. Which color would this wounded victim be assigned to? A, green, B, red, C, yellow, or D, black? So if this patient had an absent respiratory rate, he would be black unless when we repositioned his airway, he had spontaneous breathing, which in this condition he did. So the answer for this one would be B, red. Question number 9. The wounded victim is unable to walk, respiratory rate is absent, and when the airway is repositioned, the breathing is still absent. Which tag color would this victim be assigned to? A, green, B, red, C, yellow, and D, black. I feel like this one is pretty easy because we just talked about it in the last question. The answer should be D, black. Question number 10. The wounded victim is able to walk and obey commands. The wounded victim is assigned what tag color? Is it A, green, B, red, C, yellow, or D, black? I feel like this one should also be a fairly straightforward question. The answer is going to be A, green. Anything that's able to walk and obey commands is going to be green. They're going to walk to a secondary triage location to be further assessed. So that is the end of all my practice questions. I hope that was helpful. I will also post a document with these same questions on Canvas if it will help you study.